It's Monday, December 3rd, and I'm your host, Paula Hersey. On today's show, we learn about a multi-year study of the Cape Cod Canal bridges, talk about a program that helps those seniors or the disabled navigate Medicare and GAP insurance, and learn more about a special community table at the Hyannis Fire Station. Let's start with some news you can use. Plan ahead for a trip to the transfer station this week. The Transfer Station and Recycling Center, located at 45 Flint Street in Marston's Mills, will be closed from 7:30 a.m. to 12:30 p.m. on Wednesday, December 5th for annual department-wide staff training. We apologize for any inconvenience this may cause. Heads up, commuters. Maintenance work will be performed on both canal bridges this week. The Bourne will go down to 3 lanes today, Monday, December 3rd from 9 a.m. to 5 p.m. Additionally, maintenance work will be performed on the Sagamore bridges from 9 a.m. to 5 p.m. on Tuesday, December 4th. During this time, one travel lane on the bridges will be restricted and the remaining 3 lanes will be open at all times. Well, talking about bridges, rehabilitate or replace the Cape Cod Canal bridges? A multi-year study is currently underway by the New England District U.S. Army Corps of Engineers to determine whether the bridges need major rehabilitation or replacement. Stephen Tupper, Cape Cod Commission Transportation Manager, joins us in studio to tell us more about the 5 public information meetings scheduled for this month. Well, it looks like the study is finally done on the Cape Cod Canal bridges. With me today, Stephen Tupper, Transportation Program Manager for Cape Cod Commission. The evaluation study is done, and MassDOT has a study that's somewhat done as well. There's a whole lot to talk about today.
Absolutely.
And everybody loves to talk about the bridges.
Absolutely. I'm sure it'll be a topic of conversation at many holiday dinners coming up. So I'd like to lay out some of the basic status on each of the studies.
Okay. So
there are 2 parallel studies going on. The Army Corps of Engineers is doing a major rehabilitation evaluation of the Bourne and Sagamore bridges, and then MassDOT is doing a canal area transportation study that looks more broadly at infrastructure around the canal area.
Okay.
And both of these studies are at a similar phase. They're hosting their final public meetings, which will then go into a final report. So an important stage for folks to get involved.
Right. Let's just back up a little bit too. Studies are important before you go into any type of construction, you know, these evaluation studies. So they're looking at a whole bunch of different factors. What type of factors do they look at in these transportation studies?
Absolutely. Specifically, the Army Corps study is looking at the structural integrity of the bridges, something they keep a close eye on. But at this point, they're kind of taking a pause and really evaluating the structure and how it's going to perform in the long term, looking at what would be the cost to continue to maintain it versus replace the structures, and what would be the environmental impacts, what would be the impacts on the community of either of those alternatives.
Okay. And then the MassDOT transportation, you know, you know, we were just talking before the Belmont Circle, you know, the rotary at the end of the bridge. Mm-hmm. That looks at the overall traffic patterns of both bridges and what's in between and on the ancillary roads.
Absolutely. So a big challenge of the congestion that we feel at the canal is a lot of the approaching infrastructure that is certainly not living up to the modern day needs of the transportation system. So they'll look at potential improvements for vehicular access in that area, also looking at non-motorist access, so looking at improvements for pedestrians, cyclists, and how to improve transit in the area. So that looks very comprehensively at the transportation system in the scope of their study.
Right. And we'll just make sure that people understand that they're 2 divergent studies, mm-hmm. but they do have some parallels that they're actually looking at together.
Absolutely, and it's something we haven't seen in some time, a really strong coordination between the 2 agencies. Certainly physically they transition between one and another. Now they seem to be coordinating well in terms of the studies. They're looking at a lot of the same assumptions and trying to come up with a solution for the whole region. This is a big once-in-a-century decision, really, what we do with the bridges and all the
Right.
approaching infrastructure, so that coordination is very important.
Right. And the studies really aren't available to the public right yet, are they?
So a lot of the information to support them are for the MassDOT Canal Area Transportation Study. They have a project website that's up and available, and there's a series of public meetings with documentation for the last 4 years or so. So a lot of information to dig into there. The Army Corps has a little less available at this point. Really, their approach is to share it all during the series of public meetings that they have coming up in December. That's an opportunity for folks to see what the Army Corps has been working on and also weigh in with their opinions as well.
Right, and there are several meetings starting Tuesday, December 4th. They're going to be at Bourne High School. The 5th, they're going to be at Plymouth High School. Because again, it's not just the folks that live on Cape Cod, it's the people that live off the Cape and try to get to Cape Cod, either for their work or for deliveries or commerce. Thursday, there's December 6th is Nantucket High School, because the islands are affected.
Absolutely.
Martha's Vineyard is the 11th, and then finally Barnstable on Wednesday, December 12th. So there's a number of meetings that people can attend. Kind of talk a little bit about how the commission fits into all of this.
So we've been participating on the working group with the MassDOT Canal Area Study, so weighing in at important decision points along the process. And also just more globally, we're bringing a perspective of all 15 communities to these studies. And we want to make sure that these entities, state and federal entities, understand the importance of the bridges to our region. Certainly folks complain about the traffic in the summer, but it's not just that. It's really the lifeline for the entire region, and having reliable bridges is critical to the long-term sustainability of our region. So really bring that and make sure we bring the perspective of all 15 communities to the table.
Right. And as transportation manager of the program manager for the commission, what are some of the things that you're looking at for, I don't want to say that you're looking for specific outcomes, but what are you looking at or want to look at these evaluation studies?
So in the broad sense, we want to look for a long-term option that's best for the region. But more specifically, there's a whole host of considerations in that. So from the most local, certainly the canal splits the town of Bourne, and there's some very unique challenges there in terms of emergency response, getting folks to school. So we want to make sure those local considerations are being well addressed. I know the town's also been very highly involved in this study. But we also want to make sure it's understood that it's important to all 15 towns, and that reliable access over the bridge is important for the long term. Certainly in the last round of construction at the bridges, we acutely felt the impact on our community, and the thought of having that more frequently in the next coming years it would certainly be a challenge for our region. So we want something that really thinks long-term what's best for our region.
Right, and when we talk about repairs to the infrastructure, when were these bridges built?
These bridges were completed in 1935, only took 2 years to construct, so a little bit different back in those days, but they were built for a time very different than today. Back then, Cape Cod had a population of about 36,000 people. Today, we're over 200,000, and certainly the visitation here, the seasonal visitors, over the bridges, we get about 35 million trips a year. So that's certainly a heavy toll on those structures.
Wow, I didn't realize
35 million trips over the bridge each year. So these are very critical links for our region.
Right, and the narrowness of these bridges means something too, right?
Absolutely. It's about 40 feet wide for 4 lanes, so that's about 10 feet a lane. A modern travel lane for that class would be about 12 feet, so certainly very narrow, and there's no shoulders. That's the critical thing. Every bridge has maintenance activities, but a modern bridge has shoulders that allow for those activities. Really, that we're very constrained with the current cross-section of the bridge, and there's really nothing they can do with them. So the challenge is that going to be the story going forward, or are we going to have something that's a little easier to maintain?
Right, and that means too, as the approach to the bridge, obviously from Bourne and from the Sagamore, then onto Route 6, which is a little antiquated as well. Is MassDOT actually looking at that piece as once you come over the bridge, even if it might be a new one with wider lanes and more lanes, coming into that constrained old?
Absolutely. So that's an important component of the MassDOT study, is looking for, if there's a replacement bridge, what needs to happen to accommodate it on the approaching infrastructure. A new bridge would have a different profile. Right now you go up and down over the bridges, so this would be flattened out a little bit for better safety, but that really has a trickle-down effect on the infrastructure. So there'd have to be some significant improvements down Route 6 to accommodate that. And some of the discussion so far would be a potential of adding a lane all the way down to exit 2 to kind of smooth that transition onto Route 6.
Right, yeah, that's the bottleneck, it seems, in a lot of ways. Anything else you want folks to know about the studies and the meetings coming up?
Certainly I just want to emphasize the importance of making your voice heard in this. Certainly through the working groups that MassDOT's been doing in the public meetings, we've had good attendance so far. but I think we want to make a clear message to our state and federal partners the importance of these structures, the importance of making a decision that is in the best interest of this region. I know there are diverging opinions on some of the details, but I think we should have a clear, unified message that something needs to be done for the long-term sustainability of the region.
Right. And they can find the meetings where?
Both Army Corps and Mass DOT have sites with this information. We'll also post all this information on the Cape Cod Commission website, capecodcommission.org.
Excellent. Thanks so much, Steve.
Nice talking with you.
The deadline is fast approaching to change your insurance if you're on Medicare or need gap insurance. Serving the health insurance needs of everyone, or more commonly known as SHINE, is a federal program with locally trained counselors that are available to residents who have Medicare health insurance. These specially trained SHINE counselors can help you navigate and understand your insurance and find ways to save you money. Are you confused about Medicare and the coverage that you need? Open enrollment coming around the corner October 15th. With me today, Tracy Benson, SHINE Program Manager for Barnstable County. This is such a huge topic for seniors in our community. Tell us first, what is SHINE? It's an acronym for something.
It is an acronym. It stands for Serving the Health Information Needs of Everyone. And when we say everyone, it's really everyone on Medicare. So you could be under 65 disabled and have Medicare, and then you also may be eligible for Medicare when you turn 65. So we have two different populations that we serve.
Okay. And as program manager for the county, it's your responsibility to kind of train all these volunteers up?
Yes. So anyone that would be interested in volunteering for SHINE would have to go through a very intense training. It's about 8 to 10 days, full days of training, and then we have monthly meetings that one would have to attend. And we just go over the information again every month.
Okay.
So.
And these counselors are trained specifically on what people would need for insurance?
Well, it's A
more
to Z
than that.
Medicare. Yeah, so it's what Medicare is, how one would navigate through Medicare, and then really all the options that go along with original Medicare, like maybe a supplemental policy or a prescription plan, or maybe even a Medicare Advantage plan. So there are a lot of options that come with original Medicare that's fairly hard to navigate through, and that's really what a SHINE counselor, we're teaching them all of that in hopes to communicate to the beneficiaries.
Okay. So I went through this recently with a couple of family members signing up for Medicare, which is confusing unto itself.
Yes.
And then realizing that it doesn't cover everything. So SHINE counselors can help you understand the insurance coverage at the bare bones of Medicare, and then what do you have to add to it?
So typically, yes. So original Medicare is really what we would consider Medicare A and B, and that's not 100% coverage. So even if you were to walk around with your Medicare card, you know, you have a lot of out-of-pocket expenses. On the medical side, 20%. On the hospital side, you have a fairly large deductible, as well as a deductible on the medical side. So even just original Medicare, although good coverage, definitely has some what we would call gaps in coverage. And original Medicare does not cover prescriptions, which everyone should have that prescription coverage. So we have to think of ways of, okay, I have this Medicare coverage, I know it has some gaps in it, I understand it doesn't have prescription coverage, now how do I fill in those gaps? And that's really what a SHINE counselor would be talking to you about. You know, what are your finances, what is your health, how do you feel about risk, what kind of things would be the best options for you?
Okay, and that really brings us to coverage when we talk about the different types of insurances. For example, if you have prescriptions currently, you're going to need a fairly robust prescription plan.
Right, so we want everyone to carry prescription coverage, and in fact there is a penalty if you do not carry prescription coverage. So we really do try to encourage everyone, even if you're not on medications, to carry a prescription plan, because you can't predict the future on that.
Right.
And a prescription plan is really as good as what's going to cover your medications. So whether it's on the lower end of a premium or a high-end type of premium plan, you know, the best plan for you may not be the best plan for me, because it's strictly based on your medications. Out of all options, we're trying to find that one plan that covers what you are on as an individual and allows you to go to the pharmacy that you would prefer to go to, because that's another important piece. And we kind of look at those two things together to find you the best drug plan.
Okay. And then saving money, too, that seems like a misnomer when we talk about healthcare these days.
Yes.
But there were plans out there which I thought were interesting. So one of my family members is really healthy, doesn't have any prescriptions at all, and another is on dialysis. So these ways to save money, does a Shine Counselor work with the insurance companies or no?
We're going to be giving you unbiased information, so we're not getting incentives from any of the insurance companies. We're really just trying to find out of all the options, which is the best one that's going to cover you, that you find affordable, and is really just going to give you the best coverage without breaking the bank. Right. And these plans change from year to year, which is why open enrollment becomes very important to you to take a look at what do you have for plans, what's changing with those plans, and you just want to be on the best plan that's going to save you the amount of money that you want to save.
Right. So the Shine Counselor really literally is independent. And is their mandate, their purview really literally is just to help you save money and find the right plan that fits you.
It really is all about finding the right plan that fits you. We don't want to see anyone overpaying because they didn't understand something, or picking a really high-priced policy because they feel like the more I pay, the better that policy might be, because that's not always the case. And so we really just try to help them navigate that, because it's very difficult.
It is really difficult.
Yeah.
And then let's talk a little bit about all these words that get bandied about. The Advantage Plan, that's very confusing. They sound like they're the best plan, but they're just words, right?
They are just words. And you'll hear those same words, advantage, quite frequently. Okay. And it really boils down to who do you want to be your primary insurance carrier is really what it boils down to a lot of the times. Advantage plans are, we could describe them almost as replacement plans, because Medicare Advantage plans become your primary insurance carrier. And when something is your primary insurance carrier, say it be a Tufts or a Blue Cross, those are the physicians that you're going to be allowed to go to. Where if you had Original Medicare as your primary insurance carrier, the network is a little bit larger, because you can really see anyone in the country who accepts that has signed the Medicare contract. So they're very, very different things, Original Medicare and, say, a supplement versus a Medicare Advantage plan.
Okay. And we'd noticed that even in our own searches that some people don't actually, doctor's offices carry the Medicare, so you do need those supplemental plans to actually get a primary care some days.
The Medicare Advantage plans are separate contracts, so a lot of physicians may not sign a Medicare Advantage plan contract, although a lot of them or most of them are still signing the Medicare contract. That's why you really need to understand who is your primary insurance carrier, because if you've replaced Medicare with a local company, then you may not be able to see the physician that you want to go see if they haven't signed that contract. So there is a lot that goes into it. It's very network-based, and that's why we're really here to try to make sure that everyone is on the right plan. And the commercials look great, but you want to make sure you're really researching what it is you're enrolling in.
Right. Those mailers that people get at their houses too, they seem to be designed to confuse you, to say, this is the only plan that you can get. But no, there's a lot of different plans. Even here in Massachusetts, which we're a little more strict on our insurance plans, there's a lot of carriers.
There are still a lot of carriers. And yes, they're all vying for your attention. So those mailers and the advertisements on TV are always going to look like they're selling the greatest things since sliced bread. And it may be for you if you've done the research. If all the stars align, I tell people, then perhaps that is a nice policy for you. But sometimes something's not going to align for you. They may not cover your medications. They may not allow you to go see a physician that you've had a relationship with. So you don't want to get stuck in something that's just not going to be the right plan for you.
Right. And some of these plans, dental, vision, are those all wrapped into some of these plans as well?
Medicare Advantage plans, because they are network-based, so they are sometimes going to restrict where you can go. So what they have done to maybe offset some of that is they will have additional benefits that, say, Original Medicare doesn't have. And a lot of them, the dental, the vision, some of them have hearing. Those are the key things that people are looking for, that Medicare may not cover. And so as an incentive for these plans, they're going to offer those benefits.
Okay.
May be worth it, may not,
Right.
right? You may pick that plan because it has great dental, but if you can't see your doctor,
Right.
then that's not going to work for you.
So we've talked about plans where we kind of understand that we need help. The whole application process to this is mind-boggling. Never mind for somebody who might be internet savvy, but for those who aren't, is there help with a Shine counselor for applying for things like this?
Sure. So if you meet with a Shine counselor one-on-one, if you have the ability or want to enroll yourself after you've made the decision, then that's fine, but we also will help you enroll. I do a lot of the enrolling right in my office with clients.
That's
Just
fantastic.
get it done so that when they leave, everything is all set and they don't have to think about it.
Right. And you're not the only one out there. Our
I'm not the
senior
only one out
center in Barnstable has wonderful Shine counselors as well. So tell us a little bit about the network of Shine counselors. How can people find this help?
So Shine counselors, for Cape Cod and the islands, I have about 60 Shine counselors that cover the region, plus myself. So the best way to find a Shine counselor is probably to contact your local senior center. The only senior center that does not have a Shine counselor would be Wellfleet. So if you're from Wellfleet, you can contact me at the regional office, and I'm happy to help. I'm happy to help really anyone if they can't get in touch with their local Shine counselor at their local senior center, but that's probably the best way to reach a Shine counselor, is to contact their local senior center.
And we know Barnstable Senior Center has...
They have many Shine counselors there. Many of our sites have multiple Shine counselors.
Right.
And they will be busy during open enrollment. So call early if you want the appointment, and then at the regional office, we can see anybody.
Okay. And even though you have all of this done, open enrollment, you mentioned this earlier, but I want to kind of stress this for folks. You really want to take a look at your insurance now.
Yes. So open enrollment is everyone on Medicare's opportunity to take a look at what they have, what's changing going into 2019. So you're going to think about your finances, you're going to think about your health, you're going to look at your medications, and you're going to think to yourself, you know, am I overpaying? Is there something out there that's a little less money, maybe more comprehensive coverage? This is the time. This is the window to really take a look at what's going on and make changes so that when January 1st comes, you feel confident and good about the coverage that you have.
So that's October 15th
Through December 7th is the last day.
Okay.
And once that window shuts, you know, there are other windows, but this is the biggest one. So it really is a great opportunity, and I really encourage everyone to take a look at what's going on. Because you may feel like what you have is working, and it might be working, but there might be something else out there that will work just as well and maybe be a little less money. So we're all about trying to save money, as you know, we all are. So if there's an opportunity to do so, you know, it's worth a 15-minute sit down or a conversation with a Shine counselor to make sure that you're on the best thing for you at the lowest price possible.
This was fantastic information, Tracy. Thanks so much for
thank
joining
you. Thank you
us.
for having me.
It's always hard to leave a house after years of special moments, but the new Hyannis Fire Station brought a special piece of furniture into the new building, one that will build a home and new memories.
The table for us, well, there was one of the big things in the firehouse. Like I said, we wanted that to be something that we did for this firehouse for future and from the past. So one of the things we did, we found online some pictures of some steel tables that we really liked. We brought it to a local welding company, All Cape Welding, who were kind enough to dedicate the project to two former employees who also worked here, Lieutenant Rick Knowlton, who recently passed away, and Dan Clough, who passed away shortly after he had retired as well.
Right, what an
So
amazing connection.
Yeah, they actually welded their names at both ends of the table underneath the steel. So they dedicated the work and the labor and the steel to that. Judy Fenner helped us paint it. She was just about to clear coat it when we decided that what we wanted to do was show a little bit more patina.
Yeah.
So her and I spent a couple more hours sanding it down by hand to bring out the patina of the steel look. We knew we wanted a wood table. We found some barn planks from an old barn in Pennsylvania that was donated to us by Stonewood Products down in Harwich. The wood's from about 1800s. We have two gentlemen who work in construction and table works. They planed it and formed the table. And then we spent probably 3-4 days sanding it down again, filling in the imperfections, staining it. And then literally last Sunday we poured the epoxy on the top. So
Wow.
it just sealed up this past week. So when we were making the table, we wanted to recognize the fire service and what the table means of a family sitting together. So we made sure that we added 343 FDNY, which is the amount of firefighters who passed away on 9/11, as well as the Worcester 6 who passed away in 1999 in the cold storage fire. So those are the two groups that we recognize at the table when we sit here and we have dinner as a family. So
There's also a 9/11 connection. I know Lieutenant Kenny that just retired a couple weeks ago. He was one of the firefighters that went down to New York after 9/11 happened, and he brought back, what did he bring back? That is
So
part
he
of the
brought back
table?
a rivet.
Rivet.
Yeah, so Tom recently retired. He worked the pile at Ground Zero, welding, cutting up a lot of the steel. So he was able to bring back something that meant to him that down there at Ground Zero, and he dedicated and donated a piece of rivet to us here for the table.
Yeah, it's a great central, piece for the staff here to kind of sit and talk and, be with one another while they're having a meal and kind of think about, what it is they're doing and why they're doing it. I know that there's a great saying up on the wall, "I'm here to go on calls" by Lieutenant Knowlton, and I know that probably means a lot to you guys.
Yeah, and this is where we start the call, and we listen to it here at the kitchen table, and we go out and serve the community. So
Wonderful.
yeah.
Thank you so much for
Oh,
telling us
thank
about
you.
this. This
Yeah.
is beautiful. You guys did a great job.
Thank you very much.
Thanks.
Here's a look at the upcoming meetings for boards, commissions, and committees. Comments, suggestions, accolades? Connect with us on Facebook and Instagram, email us, or send us an old-fashioned note by carrier pigeon. Channel 18 works for you. I'm Paula Hersey, and thank you for watching Barnstable Today.